Welcome to the Just Ingredients podcast. I'm Cara Lynn, and here we talk all things nourishing to the mind, body, and soul. This is a place where you can find just good ingredients to life. Welcome back to the show, everyone. Today, I am actually really excited for our guest, and I'll tell you why. It's Dr. Nathan Gilmore, and he has over a decade of experience as a board-certified physician and currently serves as the Chief Medical Director at Anew Therapy and is the Chief of Service at Hoag Hospital. Dr. Gilmore brings a wealth of expertise in using ketamine, that's why I'm so excited, you guys, to treat depression and other mental health conditions. And I'm excited for him to answer all of our questions that we have about ketamine that so many of you ask me on a daily basis. So welcome, Dr. Gilmore, to the show.
Thank you very much. Thanks for having me. And thank you for wanting to discuss such an important, present content information.
Well, like I was telling you before the show started, I have so many followers that ask me literally on a daily basis, like, do you like ketamine? Do you think it's effective? You know, all these questions. And so this podcast episode is going to be all the questions that all of you guys have about ketamine, and it's just going to be my resource that I'm going to send everybody to. So thank you for doing this with us. But before we delve into ketamine, why don't you just tell my listeners a little bit about yourself, your background, and maybe why you got started into ketamine?
Absolutely. Thank you. Yeah. So I'm as you said, I'm an intensive care physician, and I practice that part-time, and I've done that for many, many years. And COVID, boy, it was hard. A lot of mental health struggles for a lot of people. And it made us all reassess where we're going in our careers and with our lives. And so my partners and I, looked into mental health because there's a lot of investigation of mental health, especially near the tail end of COVID when we had a chance to take a breath. And I have a ton of experience using ketamine in my ICUs and the emergency departments as well. And we discovered that, this is a great treatment option that a select group of clinicians have the competency to do that is right in my wheelhouse. And oh, by the way, it's life-changing for patients that have severe mental health illness challenges. And so we jumped into it. And, since then I've been spending a ton of time and energy and love. And so my experience with treatment with ketamine for mental health has been going strong for over 2 years. And it's been life-changing for me too, because, outcomes in the ICU look different than outcomes in the outside the hospital. And mental health outcomes are especially important because you might not be able to see those wounds. You not be able to see, the damage that's been done and the need that's there. But when you see them healed and you can quantify how better they are and their lives are improved, man, it melts the heart. It doesn't just warm it, it melts it. And so it's been this wonderful new opportunity for me as a physician to do something better than what I was doing before. And more importantly, to help all these patients that have this need, this unmet need of mental health.
Okay, I am loving that you love it, but I am excited to ask you all these questions because ketamine gets a bad rap. You hear a lot of positive things about it, but you hear a lot of negative things about it. And so we're going to address those things. But let's just start at the very basics for people and just explain what ketamine is.
Absolutely. Ketamine originally was found as an anesthetic. It was studied and used for anesthesia. And they ended up using it on the battlefield in Vietnam for dissociation, where you kind of go off into a different realm mentally for painful and otherwise really disturbing experiences, like setting a broken fracture that's really painful, or, you got to put some stitches in somebody or they're going to bleed out on the battlefield. And they got a lot of experience doing that. And that's in the 70s, 60s, 70s. And then it became very used in anesthesia. And they found that patients after these events had a mental health bump. And if they analyzed, hey, how are you feeling after your surgeries and after your experience, they noted a better mood. And they actually were able to do some retrospective studies that showed, wow, patients that got ketamine had a better mood. Patients that didn't get ketamine didn't have as much a better mood. So that led people to study the impacts of ketamine itself on mood. And that started in the 90s. And Yale was they dug into this. There's actually a lot of research on positive mental health and psychology based in Yale. And the kind of the sentinel papers included that, turns out ketamine for mental health, especially crisis mental health, severe, refractory, is better than pretty much everything else we have in reversing your mood and especially suicidality. And that there were some, just amazing research papers published in the early 2000s that blew everyone's mind, because we're talking about mental health illnesses that otherwise previously were refractory. Like almost nothing worked. Sometimes electroconvulsive therapy, shock therapy was tried and it helped some for sure, but ketamine was better than that. And ketamine in that episode of severe mental health challenges of crisis, refractory, reverses the mood disorders and especially the suicidality. So that shifted the use of ketamine. And now we have kind of two options. I use it in my intensive care unit all the time for pain medicine adjuvant, as well as for sedation adjuvant. And then now for mental health, a different dosing, different strategy, different plan. It's well accepted for mental health treatment, especially moderate, severe, refractory mental health challenges.
Okay, so I'm curious because I get this question quite a bit. People will say, so-and-so told me to try ketamine, but I don't really understand what it's doing to my mind to help the depression. So can you explain that?
Absolutely. And that's where it's such an interesting medicine. So it works on the glutamate system, which is a neurotransmitter. It's one of the signals in your brain. It's like the messenger signal, chemical. And it blocks a receptor called NMDA, and it changes the amounts of glutamate that are in the system. And basically what it does is it forces a rerouting of your neurotransmitter balance and what we call neuroplasticity. So if someone's in a bad mental health situation, they often have psychological ruts where they are just tunnel vision, depressed, tunnel vision, anxious. And anybody who struggles with that knows, like they can't get out of the depression because that's just where they're at. They're in this massive neurological rut. And ketamine helps reset that. It gets you out of the rut, and now you can have neurotransmitter pathways that are different from before, which include a better mood, better balance of other neurotransmitters as well. That's the thing about glutamate, is glutamate affects other neurotransmitters too. And they've done functional MRI studies that show different parts of the brain light up afterward, which wouldn't happen without it. So if you take a depressed patient, you do an functional MRI, there's a pattern. You give them ketamine, you do a functional MRI, the pattern looks different. Different parts of the brain are active that were dormant before. So it's so fascinating from a scientific standpoint. But the clinical, when you see the patient itself and you see how they're responding, it is so satisfying because you get to see someone who's so desperate and so challenging in their lives have a new lease on life, truly.
Okay, so someone at one point explained it like this to me. So see if this is a kindergarten, 101 approach that you could tell people. So they had said, let's say that you're anxious all the time, then your brain, pretend those neural pathways are like rivers or streams, and you always go to this one stream when something is like, gives you like maybe that nervous feeling. You're like, oh, I have to be anxious. I only know this one stream of how to act, where ketamine will give you a new stream of where it's like, oh, maybe I don't have to be as anxious. Oh, I feel a little calm, or I see it in a different perspective because now I'm going down a different stream. Does that make sense? Is that correct?
That is perfect. Your description is so great. Neurotransmitter pathways are very much like streams, and they're regimented highways per se, and if you change the flow of the chemicals, it can find a new route. And that new route is a healthier route. And it takes you out of that rut of all I know is anxious or all I know is depressed. And it allows you to step out of that and then reassess where you're at and plan a different pathway and actually model your brain and your neurotransmitters to a new, more healthy pathway. That's the best part, is it gives you a pause, and your brain is called neuroplastic, where you're going to create a new path for that river that's a healthier river. And over, the series of treatments, it's transcended. I mean, over the series of usually 4 to 6 weeks of treatment, patients are profoundly better off.
Okay, so I'm glad you just said that about treatments, because I have had people say, oh, I did one treatment and felt so much better. And then I've had people say, I've done 4 times and don't really see much success. And so is it just dependent on people's body and health, or what's playing a part in that?
That's a great question. And every patient is different. And so I have to be careful there. But in general, the best evidence for this shows that a series of treatments has the greatest impact. And so, at Anew Therapy, we follow the general protocols that are published, which is usually 4 to 6 weeks of treatment. 6 treatments generally is the best published literature on this. And that shows a very significant mood shift that's quantifiable. That being said, after 1 dose, so the first studies were 1 dose, they showed a decrease in suicidality that was statistically significant after 1 dose. And so I'm not saying it doesn't help people after 1 dose, but the greatest impact is to get the full series of treatments. And there's a lot of things you can add to it to make it better. But the medicine itself has its greatest impact on a series of 6 treatments. And there will be more research on this that'll help us fine tune this over time. But right now that's the best understanding. And individuals that aren't having as much of an impact, I would chalk it up to they have a different, neurotransmitter balance. Their biology is a little different. At Anew, we really try and customize the treatment for the patient, and which means sometimes you have to adjust the doses and make sure they're getting the just right amount of dose, because maybe that patient that didn't have a great response was getting too low of a dose, because how you receive the medicine affects how much gets into the brain. And too much is too much, and too little is too little. So, at Anew Therapy, we're very focused on finding the Goldilocks amount. And I can't really speak to what other places do necessarily, but I know the published literature does have some good recommendations on why we do what we do. And some patients have life-changing recovery and improvement after 1 or 2 treatments. It is profound, and they come in crying on their 3rd session because they're just so grateful, they're so much better. And others don't have that breakthrough until after the 6th session. And others, sometimes they need follow-ups. They need to be checked every 6 to 12 months and have another, booster treatment. And I'm not going to say every single patient's going to have this transformative experience. But boy, the literature supports that more than half do.
Interesting.
When you talk about treatment-resistant, refractory depression, anxiety, where nothing else is working, literally, they've tried 3 different medicines, they've tried everything, nothing else is working, and they're that desperate. They're going to maybe commit suicide, or they're going to lock themselves in their house, or they can't leave. More than 50% have a very significant benefit. So that to me is just mind-blowing, because you go from nothing's working to, oh my gosh, 2/3 of the patients have a very significant benefit.
Yeah, that's incredible. Okay, so you mentioned this a little bit, that some people need follow-ups, but for some people, does a series last a lifetime, or you have to do every single year?
That's a great question. And, at Anew Therapy, we are very focused on patient-specific care and let the patient's needs drive what our treatment is. The literature describes that some patients have, I don't want to say cure, because that's a really strong word.
Right.
But about 10% of patients end up decreasing or stopping their other mental health medications. So to me, that's pretty close to a cure. Disease-free state. That's mind-blowing in terms of benefit. And other people, they do great. They decrease their dose of their other medications, but they still benefit from, their Prozac or their Paxil or something like that. But they decrease their dose. But, hey, it's February, it's gray, it's snowy. They have a little seasonal affective depression, which is very, very common. Getting a booster of ketamine has been shown to help those people. So, our recommendation to Anew is to customize the therapy for the patients. But in general, most patients don't need this forever. They do the series, they have a transformation, their life has changed profoundly. And the patients that may need more follow-up, it's not going to be, oh, I got to do a series of 6 every year or every 2 years. It's usually one shot every 6 to 12 months off and on, as needed. So at Anew, we measure the patient's severity of symptoms, and we're quantifying those and analyzing those. And we recommend patients track themselves. There's like scientifically validated surveys that help patients know, how bad is my depression right now? How bad is my anxiety right now? And we do a scale, and if it's like super bad, oh, you better get some treatment. And if it's kind of just mild, okay, well, maybe go see your therapist, or maybe do some other things like, physical activity or other known benefits for mental health. And so we actually recommend to our patients to track yourself over time. And if you see yourself getting in the orange and red, give us a call, talk to your psychiatrist, talk to your therapist, get help.
Okay, that's so good to know. So another question that I get quite often is something along the lines of, I have a teenager son or, an 18-year-old daughter who I want to try ketamine with, but they're terrified. It sounds scary. So could you just explain like what a session entails, what happens, and maybe what the person would feel during a session?
Absolutely. And that concern is so real. Anything medical is so scary, especially when you're young and you got these, stuffy doctors and nurses and needles sometimes. And that's real. So I validate that. And at Anew Therapy, we respect that. And so we made our treatment facility, they call it set and setting. And there's actually literature published on this, like how you create your environment for your mental health care actually matters, and how the patient receives it. So it feels like a nice spa or something, because we wanted to be calming and at ease. And so you come in and you're greeted and you can rest. We actually have a meditation area in our facility in case people want that. Some people do. There's a lot of discussion about ketamine setting intentions before the treatment, where you write down the things that are 3 most important things that you want to really metabolize while you're in this dissociated state. And then you're in your room, and for us, at Anew Therapy, we just give 1 injection, usually in your deltoid and in your shoulder. And you actually kind of drift off into a dreamlike state. They call it dissociation. And it really is like a dreamlike state. You're in a little bit of altered reality. And that's the neurotransmitters changing. Those rivers we talked about are changing when you're in that state. And the last anywhere from 30 to 60 minutes, sometimes a little longer, sometimes a little bit shorter. And at Anew Therapy, we do 2 doses. There's some evidence that shows that if you give a little bit more over time, there's a little bit better bump for outcomes. And it makes sure we have the Goldilocks amount. We don't want to give too much, we want to give too little. And so you're there for about an hour and a half, sometimes 60 minutes, sometimes 90, sometimes a little longer, resting. And then you come out of this dreamlike state, and you're ready to go home. And you go home. Sometimes you're sleepy and just want to kind of rest the rest of the day. Some people actually find it activating, though. They're like, I got stuff I got to do. I'm going to go. But that's less often. It's more often you feel a little bit sleepy. We do have the possibility of having psychotherapy, talk therapy during your ketamine. Sure. And at Anew Therapy, we found that certain diagnoses, especially PTSD and sometimes bipolar, we found that therapy is a really important part of working through those hard things. And we found that there's actually literature on this too, that certain diagnoses can be triggered during the ketamine. And so having a therapist there to help them talk through that and start metabolizing during the ketamine itself is helpful. It's not necessarily proven by this amazing research, double-blinded, placebo-controlled trial that's Harvard-based. It doesn't have that kind of literature behind it, but we found it's a great value add, and so we offer it for our patients. And I've had personal family that I've said, you really should have a therapist for this during your ketamine treatment. So not everybody does it, but I for some patients, it adds great value to the experience.
Okay, that's good to know. So it's not an actual IV. It's just a 1-time, maybe 2-time injection.
And that's where it could be. So There's a couple different ways you can receive the ketamine that are effective. IM is intramuscular, just a shot in the arm. It's simpler in a lot of ways, so that's why at Anew Therapy we've decided to go that road. Some places do IV, intravenous, and there's pros and cons to both. Those both kind of have the gold standard in terms of the greatest noted impact on the central nervous system. But now there's a newer medication called Spravato that's intranasal, and it's absorbed intranasally. There's right behind your nose. There's your neuroreceptors are actually right back there, and so it gets into the brain better than by a pill. And so that it's called Spravato's the trade name, and they did some great research, and it definitely has significant benefit. And a lot of facilities are offering Spravato. Anew Therapy is offering Spravato as well. But those are the three main routes that are really useful and most effective. There are some places that offer by mouth. We don't at Anew Therapy because the literature behind it is not that convincing. By mouth, the ability to have the transcendent impact is just not high enough. So we like, hey, if we're going to do this, we want to have patients have the benefit. So we recommend IV or IM. And Spravato now has enough literature behind it and enough experience that it's for the right patient, it's a very good medication as well.
Okay, and so during this process, you may fall asleep or you may not fall asleep, correct? You're not necessarily put to sleep like some people think.
Correct. A lot of patients are pretty awake, and they definitely are in an altered consciousness and dreamlike, but their eyes are open and so I've used ketamine in my clinical world in the ICU and the ER, and if your child breaks their wrist and goes and has to get a wrist, straightened out and put a cast on in the ER, odds are they're going to use ketamine. And if you're going to a dental, deep surgical, whatever, and if you Google those videos of after ketamine on the drive home, that's not too far off. Those are way higher doses. So those can be a little bit extreme. That's not what we have at our facility. But it does that to your brain. It's you're in an altered state. And often their eyes are open and they can interact with the outside world, but they're definitely altered. But some people, a lot of them do fall asleep. They're easy to wake up. You just nudge them. Hey, I'm okay. I'm just resting. And that's all it is. Most patients just fall asleep for 30 to 60 minutes. And then they wake up going, wow, I've had some dreams. They said, you need to talk to your therapist about those dreams because that's part of the medicine working.
Well, and maybe that's where some of the confusion is that it's used in ER situations to maybe a higher dose to help put people to sleep or in a more altered state. And so people hear that and then they're afraid to go to a clinic because they think they're being put to sleep, as I say with quotation marks.
Absolutely. And that's a very reasonable question and concern. So I would strongly recommend get more information. The dosing is totally different, and the endpoint's totally different too. And this, like I said, I've got a lot of experience using ketamine on patients, and my colleagues in my field, similar. I'm not alone. This is something we do all the time, and we use a way smaller dose, and it's targeted, and there's actually good literature on that too. And it's not just like I came up with this cookbook. I'm following the best practices in the published research. So.
Well, in talking about misunderstandings, let's maybe talk about that. Why does ketamine get such a bad rap? Because anytime I talk about it on social media, I'll get half the people that love it and support it and have tried it, and another half that are like, how dare you talk about this? This is unsafe. This can be harmful. You know what I mean?
Yeah, there is such a stigma, and it breaks my heart because, the drug has some hallucinogenic effects, but so does other medicines we use in the hospital all the time. So medicines have strong effects, okay? Some people get super altered when they take oxycodone or morphine, So that doesn't mean, you should or shouldn't take morphine. You should take morphine if you need it. If you have a femur fracture, your leg's broken, morphine's reasonable. If you're just, trying to go golf, probably not. ketamine has some strong neurologic effects, very strong. And it had been used in the 70s with, other drugs, just like morphine, just like oxycodone, just like OxyContin. And when it's abused, it gets a bad rap. In the setting of mental health, I can't say this more clearly. I want to shout it from the rooftops. There's nothing this effective. And I'm not just saying it because I think it. When you read the literature, there's nothing as effective as ketamine for severe refractory depression, anxiety, and other mental illnesses too. But there's nothing this effective for refractory depression and anxiety, period. So it needs to be done carefully. It needs to be done under a modern setting. You need to have the right treatment team, the right clinicians, the right equipment. It needs to be done carefully. At Anew Therapy, we've perseverated over every little thing.
Okay, that makes sense. Do you think that maybe some of this misunderstanding too, at least I get asked this, people will say to me, well, isn't it like a psychedelic? So does it get classified in the same group as psychedelics?
That's a great question. And, I think in some ways we're kind of splitting hairs, tomato, tomato, potato, potato. Psychedelics have a street connotation, and LSD was studied to be used for medicine as well. And they realized this is not good to use for medicine. And so that's how they found ketamine, is when they were starting with LSD. And so they're akin. They have very different profiles. Ketamine is much safer, much less strong. It's got its medical indications. Nobody ever uses LSD to treat patients. So in some ways you could argue it does live in this world of psychedelic, but in medicine, I don't use the word psychedelic. I know it's in the literature. They describe it as a broad term. But I describe ketamine as an anesthetic that has a dissociation effect. And that's part of the goal. So, if people are using ketamine at a party, then yeah, that's terrible. They're using it to try and do, whatever they're going to use drugs at a party for. And I don't recommend that to anybody. I think it's terrible. And however they got the ketamine should be pursued, and that it's a super controlled substance. There's a lot of things about that are that's so wrong. But in the clinic setting, with the right environment, the right diagnosis, the right treatment, and it's, it's just like morphine. Morphine is a narcotic. It's an opioid. It's got all those bad things narcotics are bad, unless you have a femur fracture. If you have a broken femur, you need pain medicine. If you have cancer, you need the right kind of pain medicine. If you have terrible mental illness disabling you, you need the right treatment. And this one's a strong one. But in terms of the comparisons, ketamine is by far the best option, in my opinion.
Okay. And, on these posts where I talk about it, people will be like, it's caused death in certain people. And I'm assuming it's like anything. You use too much morphine, it can cause death. So again, it's that comparison, correct?
Absolutely. And I'm glad you brought that up, because, the Matthew Perry situation is so heartbreaking for a lot of reasons. First, for him.
Right. Yeah.
We all love Matthew Perry, right? And his family and his friends. And plus the way it played out, he had 6 times therapeutic dose levels in his system when they drew the blood for the autopsy and things. So he clearly had so much in his system that is outside of recommended dosing, let alone he wasn't in a clinic with the monitoring system, with the treatment team right there. It was so outside of the recommended treatment options that, bad things happen when you do that. And, as you described with morphine and oxycodone, OxyContin, those drugs are dangerous. If you take too much of that, you're going to stop breathing and have an event and die. I mean, the opioid epidemic in the world, United States being, a big, place for that too. It's heartbreaking. A lot of people are using these drugs inappropriately, and they have terrible consequences. So it's similar to that. And ketamine is so controlled. That's how they were able to find those doctors that were breaking their oath and distributing the ketamine, unfortunately, way outside of the recommended pathways, because it's so monitored. The DEA keeps super close tabs on how you're doing this. So it's all about doing it the right way, the right place, with the right providers for the right illnesses. Obviously, Friday night fun, not okay. And I would want anyone that thought that was something they'd want to do to really reassess what they're thinking about with their lives and find a way to get help in a better way, because ketamine, among other drugs, is not a great thing to do for fun.
Well, it goes with the saying of more of something is not always better, and that's the case with ketamine. Let's take a quick break to hear from our show sponsor. My favorite bee propolis brand is Beekeepers Naturals. What is propolis? It's the ultimate defender of the beehive, crafted by bees from a blend of plant and tree resins, combined with their enzymes. Think of it as nature's immune booster. Propolis is packed with essential nutrients, vitamin B, C, D, zinc, and tons of antioxidants. With over 300 beneficial compounds and high levels of polyphenols, it fights oxidative stress and strengthens your immune response. I use Beekeepers Naturals Propolis throat spray often for proactive immune support to combat fall germs, and it is great if my kids feel a sore throat coming on. Beekeepers Natural is also my go-to for soothing lollipops, lozenges, cough syrup, and more. They have options for the whole family that are free of refined sugars, artificial flavors, and dyes. I received a special offer for all of you listeners from Beekeepers Natural if you go to beekeepersnatural.com/justingredients or enter code justingredients to get 20% off your order. That's beekeepersnatural.com/justingredients or enter code justingredients for 20% off site-wide. This code can also be stacked on a subscription. Ready to defend your health? Visit Beekeepers Natural and experience the power of propolis today. Now back to the show. But I am curious because Matthew Perry, we know, had quite a bit in his system. So does ketamine stay in your system for a while or no?
No, and that's another thing where we know concretely he had a lot ingested.
Oh, okay.
Right before he died. So that was an acute event.
Oh.
So the half-life is 60 minutes to 90 minutes, meaning half of it's gone in your system by then.
Okay.
So it's gone by 4 hours. Ketamine is completely eliminated by 4 to 6 hours. So when Matthew Perry died, he had just had a lot put in him.
Okay. Yeah, it definitely comes down to finding a provider you trust. And so maybe that is a question I should ask you, because I know people listening are like, oh, maybe my brother could really benefit from this, or my spouse or whoever. But how do I find a good provider of this? I don't want to end up in a Matthew Perry situation.
And that, thank you for talking about that question, because I'm most worried that people are going to be afraid to look at it because of this.
Mm-hmm.
And I would say look harder, look closer, because not every clinic is the same. And I can't speak to what other places are doing. I can only say what Anew Therapy does. But Anew Therapy, we're super focused on setting, on the right monitoring, the right equipment, and the right dosing, and the right providers in the building. So it's interesting. The state of Utah has a statute for ketamine where you have to have someone who's airway competent and ACLS, which is advanced cardiac life support, who's able to handle an situation in case it ever happens, which is pretty high bar. So Utah created a bar that's like, hey, you can't be doing ketamine treatments unless you have these things available to you, which is fantastic. But that doesn't mean the facility is actually doing that. So, buyer beware and do your research and talk to us. And if we're not close enough to you, or you have a preference for somewhere else, that's fine too. We'll help. We'll coach you through to make sure you're not walking into a scary situation. And I'd liken that to any other medicine. And you want to make sure you're getting the right dose, the right place, for the right reasons, and make sure you're not doing it for the wrong reasons, or the clinicians are kind of like loosey-goosey. Nobody wants a loosey-goosey doc who's just phoning it in, period.
Okay, so I'm curious, is ketamine allowed in all 50 states?
Yes. So ketamine's FDA approved, and it's been FDA approved for 40, 50 years. And its use for mental health is available everywhere as well. It's got different adoptions, and some places have more or less stigma, and more or less availability. That's another challenge, is not, if you're in some town, wherever, they may not have a ketamine clinic that is able to do the right way that we're describing. Most metropolis areas do. Throughout the United States, it's international. I mean, it's used in Europe as well for this. So it's available, but like we've talked about, buyer beware, be careful, make sure you're walking into the safe monitored environment.
Okay, so I have a question. We keep saying that ketamine is amazing for mental health. And so when we talk about that, is it great for all the different ones? Are we talking bipolar plus anxiety plus depression plus PTSD? I mean, the list goes on of mental health issues. So yes?
So it's a great question. And the short answer is had a lot of research on depression and a fair amount of research on anxiety. And those two illnesses have profound benefits and well understood. They've also done good research on PTSD, on anorexia nervosa, on and some on bipolar, and other mental illnesses. But the core ones, there's benefit. It won't be as beneficial per se for every mental illness, but the depression and anxiety are there's such a strong body of evidence that, boy, this is great treatment options. For PTSD, I found that we've had a surprising benefit that is very refreshing because bad PTSD is really hard to treat. And so adding ketamine to that treatment option is a great additional mix. And then bipolar is another interesting one where there's different kinds of bipolar, and doing it the right way can have benefit for bipolar as well. So, but the research behind depression and anxiety is really solid. And internally into the Anew Therapy, we track all our outcomes and track, responses. And, for example, someone who's got moderate severe depression, we found 2/3 of patients had more than 50% reduction of symptoms. So pretend their severity score is 25. 2/3 of patients, their severity score went below 12. 2/3, okay? And 80% of patients, 80%, 4 out of 5 patients, saw their symptoms cut in half. So I know they're a little bit, like doing the math, like it's kind of hard to do that math, but we have different graphs and things. But that's 2/3 or half, 4 out of 5 patients have their severity of symptoms cut in half. And I don't know what other facilities are measuring or monitoring, but in Anew Therapy, we want to just put it on all the posters, all the billboards. If you have moderate severe refractory, come get help because nothing else out there can do this. It's just, someone who, struggled through the end of COVID, and I have family and friends who had their own burdens and weights and just hard, heavy things. This is transcendent. It changes people's lives.
Okay, so I have a question about this because it sounds amazing, and I know it's helped many, many people that I've talked to, and it's been a blessing in a lot of people's lives. But as you know, on Just Ingredients, I talk about living a healthy lifestyle. And I know there are lots of different root causes to depression. I mean, someone that's very low in B vitamins is just not going to feel good mentally. And so is this something that you say, hey, this is one tool in the toolbox, but when you're done, you can't just go home and eat Oreos all day and think you've done a one-time cure-all? So is it one tool that's going to help people, but people still need to take care of other healthy things?
Thank you. Thank you for adding this because, of course, there are so many things that make depression and anxiety worse and or create it in the first place. And healthy lifestyles is a major contributor. There's a lot of other contributors. There's genetic forces. There's a lot of things that can influence and create this setting for depression and anxiety. So this patient population is like moderate severe refractory. And so these patients have tried a lot of those things, if not all of them, and it just didn't quite get them there. So the ketamine reroutes the rivers, like we described earlier, and gives you a reset. But you got to take advantage of that reset. And that's where we recommend so strongly intention setting. Talk about the things you need to change because now your neurotransmitters are ready to change. The river is ready to reroute. You need to guide the rivers where it needs to go with healthy eating, with activities, with healthy interactions with other people. And that's where we think a therapist can help you work through that. But the therapist isn't going to help you with your diet. You got to work on that yourself. And so, your points are very valid, and nutrition, activity, interactions with other people, all those things are essential for helping reroute the river in a way that creates that new path because you're going to get a chance to reset.
I love that phrase, and I think I might use that when talking to people about ketamine, about taking advantage of the reset. That's exactly what it is.
And even without taking full advantage, you're still going to have benefit. Patients that were suicidal aren't going to be suicidal. Okay, there's profound benefit. But man, if you're given a chance when you struggled for years to reset and plan a new path, do it. Your future will never look brighter.
Well, I'm thinking, because you may or may not know, I struggled with depression and actually attempted suicide. And I'm thinking, 17 years ago, had this existed, it wasn't around, at least that I know of back then. I'm thinking this could have helped me get out of that really dark spot to then be like, oh, okay, I need to learn about nutrition and maybe do that a little bit better. Maybe I need to start exercising, but it would have gotten me out of that deep, dark place to then start working on things.
Thank you for sharing that. I mean it. People like you can vocalize their challenges. It allows other people to do it and say, hey, I'm struggling, I need help. And go get help. And it'll include nutrition. It'll include activities. And for that deep, deep, dark place, ketamine is a exceptional and important opportunity that shouldn't be missed. And you're right, 17 years ago, only big academic centers were really using it. It was not readily available or as understood. But now it is. So I'm grateful that you made it through that and you've been able to create this wonderful platform of discussion and learning and making a healthy life, and allow other people that are struggling to say, I need help. And ketamine may not be what's needed for that person, but a lot of people it is. If they're in that deep, dark place, yes. And I don't know all your diagnoses or all your things, but I can tell you, if you're severely depressed and you're suicidal, ketamine is for my loved ones, people that are in my life. I've had my physician's assistants do the treatment because I don't want to be the one directly managing my family. But I've managed my partner's family, and I would recommend this treatment over inpatient mental health for a lot of times, or shock convulsive therapy, the really drastic stuff. Ketamine is such a great opportunity for that severe situation. So I really, once again, thank you for sharing that and voicing that to all your viewers, because it gives them the freedom to say, me too. I want help.
Well, and I also say, when you're at the point of suicidal depression, that is totally different than just having a bad day. And I always tell people, rate the depression on a scale of 0 to 10. On a day of 1 or 2, yeah, like going and out to dinner with a friend or serving somebody might help you feel better. But when you're at a 9 or a 10, that's not going to help. You need something more like ketamine. And so this is a great option for people to know about.
You really know this stuff, because that's exactly right. That's why we do the measurement. We quantify the severity of the depression. And if you're not above a certain threshold, ketamine isn't recommended. And so we do these analyses. The PHQ-9 is a depression score. There's other ones out there, but that's what we use. And there's an anxiety score as well. Because if it's just kind of a rough day or two, and rethink some stuff and exercise and eat better and just reset, But if you're at an 8 and a 9 for multiple days and you're literally thinking, maybe I'm better off dead, red flag. And oh, by the way, your PHQ-9 score, your depression score will be really red. Go get help, which could be us at Anew Therapy. It could be another facility, but talk to somebody, get help. And your description of that is so spot on. That's exactly what we do.
Okay, that's good to know, because I didn't actually realize that you guys rated the depression or anxiety. So that, I think, is really helpful for people to realize, oh, okay, this is for when I am in those really dark spots.
Yes, and if you're not really there, you're not threshold, then we say, hey, let's talk, stay in contact, talk to your therapist, talk to your mental health provider, maybe change your other medicines, and we'll see. But if you're in the orange-red zone, okay, let's schedule this. Let's get this done as soon as possible. And I can't speak to what other facilities do, but at Anew Therapy, we follow the guidebook, and the PHQ-9 score is well validated. We do it before, during, and after your treatments, and we recommend people to track themselves over time to see where they land. Hey, February is a rough month for me because of, the winter and whatever. And I checked myself. I was like, my score is in the orange and red again. I'm going to call Anew Therapy, or I'm going to call my psychiatrist and say, hey, I'm struggling and maybe you should get a booster.
Okay, I'm glad you said calling your psychiatrist. Do you think, are most psychiatrists and most therapists on board with doing ketamine, or is there a miscommunication with them as well?
That's a great question. And I've seen such a variety. Like, I have a family member whose psychiatrist was like, I honestly didn't think they understood what was going on. That psychiatrist probably should retire for a lot of reasons. They're just at the end of the career, and that's okay. I'll be there too at some point, maybe sooner than later. These gray hairs. Versus, we had dinner with this psychiatrist who has changed the world. He's part of the Spravato trials, which is the intranasal version that's funded by insurance companies and things. And he has touched and changed thousands and thousands of patients' lives. So there's a mix out there. And I'm not saying you go shopping for your psychiatrist, say, I don't like what he said, I'm going to go to that one. But if they can't speak to what ketamine can do, and they're like, well, I don't really know, then you probably should reassess. And you're thinking about ketamine, you probably should reassess getting a partner in your mental health world that is versed in ketamine. I personally feel like there are a ton out there. There are nurse practitioners that have a lot of experience in mental health. There's actually a field of nurse practitioning in mental health only. And obviously a lot of psychiatrists now they're all about this. So I think it'd be uncommon for you to find the psychiatrist like I described for my family member. But they're out there, and I embrace it. It is what it is.
It happens because I get, almost daily someone that says, I went to this doctor and they said the only thing out there for depression is an antidepressant, which I don't have anything against. They can be life-saving for people, but when a doctor says that's your only option, we're not even going to do blood tests. I'm not going to tell you about ketamine. I'm not going to do, I'm like, no, time to find a new doctor.
I'll be the first guy to say, get a second opinion about anything. Second opinion never hurts. And it's your body, it's your loved one. Like, be as informed as you possibly can. And if you feel like this doc or this, provider is like, well, I don't know, they don't know what they're talking about, trust your gut and go get more information. Because I'm not alone here. I'm actually just regurgitating what a lot of really, really smart psychiatrists and mental health experts have published extremely good papers about. New England Journal, JAMA, British Medical Journal, like the best journals, best research possible. And then I see it in my clinic, and I'm like, this is so amazing. So don't just take one person's word for it and say, well, like my primary care doc didn't think it was a good idea. Well, I'm not sure your primary care doc has any idea about this.
Okay, well, I have a couple more questions that I know followers will want answered. So the next one is, can I do this for kids, teenagers, or is there a certain age that they have to be to do ketamine?
That's a really good question, and it's a tough one. The younger they are, the more we don't have amazing research on for mental health. That being said, the brain is plastic when you're young anyway. And like I said, if you break your wrist as a 10-year-old, you're probably going to get ketamine to get your wrist put back in place. So we use ketamine without flinching for some other reason at a much higher dose. So at Anew Therapy, we talk with a pediatrician, we talk with their mental health provider team, and we talk with the family and the patient. They all have to be in agreement before we'll consider offering ketamine for a minor. And it's pretty uncommon, but I'm telling you, I had a really, really good friend of mine whose child was very depressed, teenager, and overdosed on some pills. And maybe it was a cry for help, maybe it was a genuine attempt to commit suicide, but still, as a parent, that is the scariest thing you can think of. I can't think of anything harder or worse. And I said immediately, make sure he gets ketamine and find a place that will work with you. And he's like, it's funny, my pediatrician actually recommended it. So it's not super common, but when you think about the alternatives, a 16-year-old, 15-year-old who commits suicide or tries to commit suicide, and then being put in inpatient facility, and there's a lot of other trade-offs. If it's my 15-year-old, absolutely consider it. And at Anew Therapy, we have a really careful stepwise approach to make sure we're not doing anything outside of the loop of not recommended. And I would definitely recommend that. I wouldn't want to do it if the pediatrician wasn't on board. I wouldn't want to do it if their normal mental health provider wasn't on board. But especially if you're a teenager suicidal or their life is just truly disabled and dysfunctional because of their mental health, absolutely consider it. Very good question.
Okay, so I have another question that I get, and I think I know how to answer it, but I'm just going to ask you this. So people will write in and say, okay, I know that ketamine changes the neural pathways. I'm afraid if I take my 16, 17, 18-year-old in, it's also going to change their personality because of that. And so what do you say to that?
That's a great question. And, in some ways, it probably will, in that if they're severely depressed all the time, they will be less severely depressed all the time.
That's what I tell them. I'm like, it'll make them happier maybe.
Yes. And less anxious if anxiety is their driver. And so in some ways it's on purpose, but it won't change the core of who they are. If they really like punk rock, they're still going to like punk rock. If they really like pink all the time, they're going to like pink. If they love football, they're still going to like football. And if they're still like, a bookworm, they're still going to be a bookworm. But they'll be less disabled by their mental health challenges.
Well, they always say to me, they're such a sweet kid and I don't want that sweetness taken away.
If anything, the sweetness will be more amplified because the other disabling aspects will be much more in the background. I'm not going to say they're removed. I'm not going to say they're going to be cured, but they'll be much more in the background. And the more of who they really are will blossom. And that's the other thing about, the younger minds that are struggling. And, going back to COVID, my family had some real hard things because of the school closures and friend disruptions. And there's research now on the consequences that's just heartbreaking to what it did to young minds. And I want to give them the opportunity to blossom fully. And if you're in a rut of depression, anxiety, you're not blossoming. So don't let the disability of mental illness ruin your life, especially when you're 18 or 17, you're just starting. Like, let's reset. Let's do the reset. Let's do the reset and let you blossom in the ways you want to blossom instead of only in the depression, anxiety path.
Well, you have answered so many questions that I know I get quite often from followers. But as we wrap up here, are there questions that you guys get quite often that I haven't asked you that might help others understand this more?
No, your questions have been phenomenal, and they're honestly the highlight reel of all our questions. We're on the phone all the time, and hey, well, do I need to have a mental evaluation, and who does the evaluation, and how do I know it's safe, and should you talk to my psychiatrist, and can my psychiatrist do it, and so our process at Anew Therapy includes an evaluation to make sure you're the right type of patient with the right type of mental illness challenges, that you're medically safe to receive ketamine because it's strong medicine, and we don't want to give it to people that are going to have a cardiac arrest, which knock on wood, doesn't happen because you have the right patient profile. And we do a deep dive on that. We check with your clinicians to make sure they're on board and they're not against it, and that they're going to track the other medications over time. And then, obviously informed consent to make sure the patients understand and they're wanting to go through it. One last question that you haven't touched on that's really important is the barriers. And financial barriers real. So for IV and IM ketamine, your insurance company generally doesn't pay for it unless you have like an HSA or a flex spend or one of those, health savings accounts. And those usually work pretty well. But your general Blue Cross Blue Shields or Select Med or whatever, they aren't going to reimburse the ketamine management because they don't have an FDA indication for mental health IV and IM. So it ends up costing a fair amount because you're paying for the monitoring. You're paying for the safe environment. You're paying for the right provider to be at your bedside to make sure it's done safe and effectively. And it's worth every penny. I'm telling you, when you think about where you're going to spend your money on, if you can reset your mental health, it's worth every penny. I've never had any patient say, "Oh, it wasn't worth it." And we'll work with you at Anew Therapy. We'll make the financing work. One last thing I'll add is Spravato intranasal is funded by insurance. And so when we talk about with patients trying to find the right approach for their specific situation, if they just cannot come up with the money but they have insurance, then maybe Spravato is the right medication for them, because completing a series of treatment is better than nothing. And completing a series of treatment is better than only one treatment. So the financial burden is a real thing, and it's something we work through with you, and we make sure that we customize our treatment for what you need and how you can get it. And that's a real thing out there for a lot of people, but the options are there. So and Medicaid reimburses for Spravato as well. So in general, we can offer something at Anew Therapy.
Yeah, I've said this before. When I dealt with my mental health issues, we were so poor. We had no money, and we actually went into debt once I found help, because at that point I was like, I almost, lost my life. I'm going to go into debt for this and figure my way out of the debt after I'm feeling healthy. And so I get that barrier. It is a hard barrier, but if someone is struggling with not even wanting to be here on this earth anymore, then it's worth every single penny of it.
Absolutely agree. And like I said, there's insurance options now too. And some patients will start with the insurance base and they'll say, no, this is helping, but I'm willing to spend the money now because I know it works. And they'll transition to the IV or IM. And others will say, like you said, you know what, it's worth, this couple $1,000s for a full series of treatments. Because in the long run, and look at you, that money you spent to get better, was it worth it?
Yep, worth every penny of it.
And my loved ones are the same way. I've got some family and friends that they're tight financially, and we're like, hey, we'll make a discount, sliding scale kind of thing for you, and on the back end they're like, oh my gosh, thank you so much for the discount, but worth every penny because nothing else helped me the way this did.
Well, thank you so much for being here and explaining ketamine. I know this has been really, really helpful for people, but tell people where they can they go to your website for more, research on this, more answers? Where can they find you?
Thank you. And thanks for asking that. And thanks for having me. I like I said, I'm so passionate about this, and it matters so much to me because I know it helps people. And I literally manage people that are dying every day. So this is as important to me as people that are dying from their bad heart attacks and things. So please reach out. So we have a website, and I got to get this right, or I'm going to get, my head handed to me by my team. And I'm not the tech guy at all. So we have anewtherapyutah.com is our website. And we have an Instagram at @anew_therapy. And you can Google Anew Therapy Utah. And obviously this podcast, we have some sessions on our social media too. And we'll answer all the questions you can throw at us, because we want people to get the help, their loved ones to get the help, and reset for the future.
Well, thank you again for being here. And I end all of my podcasts by asking my guests what they have found to be the best ingredient in life. What would you say it is?
Thank you for asking that question. I thought about this, and courage. Courage isn't being, I'm not afraid. Courage is moving forward when you're afraid and when it's hard. And so people that are struggling, that dark place like you were in, and saying, I'm still going to try and get that help. And I'm still going to try and do the right thing and make my life better and make the life better for those around me. So that to me is a word that matters to me a lot, is having courage to still put one foot forward and do the best you can and get the help you can. And in mental health, and ketamine is a specific example, it takes some courage to go there and to be willing to ask and see if it's right for you. And if you're that bad off, it'll change your life.
I'm tearing up because I had lost the courage when I attempted suicide, because there was so much critical judgment of me when I would ask for help, and a lot of people not understanding it. And it just made me afraid of what people would say if I asked for help. And so I hope if you are listening and you are dealing with mental health right now, people are waking up to it. They are not as critical as they used to. They will be willing to help you. Go ask for help. Be courageous. Reach out to Anew. Look into all the different things that you can do to help yourself. And on the flip side, if you're someone listening to this and you know of someone dealing with mental health, share this episode with them. Be that caring friend, that caring sibling. Ask how you can help. And I know this episode will save lives. So thank you, Dr. Gilmore, for being here. I really appreciate it. Thank you so much for listening. Remember to subscribe to the Just Ingredients podcast to learn more about your health and good ingredients to life. Plus, get daily tips at just.ingredients on Instagram.